My name is Carlos, and this is the handover for Priya Narayanan, a 66-year-old Indian-Australian woman born on the 1st of March 1960, who speaks Indian English. She was admitted to Westmead Hospital for scheduled knee revision but experienced sharp knee pain. Her daughter Lakshmi, who noticed symptoms, accompanied her. Priya worked about 30 years as a baker in a family-run coffee shop. The situation: the patient visited the orthopedics and traumatology department for an elective revision of her right knee prosthesis. Her symptoms of pain had been ongoing for 2 weeks with a significant increase in prosthesis knee, swelling and pain, but Priya chose to wait until her scheduled knee checkup to inform it. Background: she was diagnosed with rheumatoid arthritis when she was 53 years old. She has 8 years with a prosthesis in his knee due to his chronic condition, and the last clinical checkup was 8 months ago. Risk factors: non-known drug allergies, two siblings who share the same chronic condition, rheumatoid arthritis, and work as bakers require long periods of standing. Medication: methotrexate as a first-line treatment for rheumatoid arthritis, prescribed once a week, and optional ibuprofen to relieve pain and inflammation. Family and social history: his daughter Lakshmi doesn't live with her but helps at their coffee shop and accompanies her to medical appointments. Assessment: observation and vital signs: age 66 years old, height 1.55 meters, weight 60 kilograms, BMI 25.8 kilograms per square meters, temperature 36.8, no fever. I carried out an AH nursing assessment. Air weekly, speaking clearly in full sentences, breathing, respiratory rate is 18 breaths per minute, chest expansion equal, oxygen saturation is 98% on room A, circulation heart rate is 88 beats per minute, blood pressure is 128/78, slightly elevated but is consistent with the pain she was experiencing, natural uniform skin color, peripheral pulse is purple. I also perform a neurovascular assessment of the right leg, moderate edema over the right knee, capillary refill less than 2 seconds in the right toe, dorsalis pedis in the tibial posterior pulse presented, no sensations of tingling or numbness. Cerebral pulse sharp pain, claiming my right knee hurts a lot and I feel pressure pain in the area. Disability: patient is alert and aware of her surroundings. In PQRST assessment, pain triggers: walking around the coffee, especially while carrying trays or standing for long periods, relieving when she rests with her leg elevated and applies cold compresses at home. Quality of the pain: Priya described sharp pain when bearing weight, internal pressure as if the knee is full, and occasional burning around the swollen area. Region: right knee, but sometimes rotates to the front of the thigh. Severity: 7/10 when walking, address 4/10. Pain has increased over the past few days with intense peaks in the morning. Exposure: a musculoskeletal assessment was performed at this stage on the right knee. In inspection: increase in volume compared to the other knee, mild to moderate erythema in the peripatellar and medial region, no necrosis, no open wounds, no drainage of fluids, no ecchymosis, no associated skin lesions observed. In palpation, the temperature was slightly increased compared to the left knee, significant pain in the suprapatellar region and medial joint line, sensations consistent with significant joint effusion, mild in duration, no subcutaneous crepitus detected. During measurement, right knee 45 centimeters measured at the superior pole of the patella, left knee 39 centimeters, extent of erythema approximately 4 centimeters around the previous scar, limited flexion due to the pain, full extension but painful. Functionality: limited gait and requires support for ambulation, morning stiffness, no reported fever, just general discomfort and fatigue. Fluids: urine output is normal, no signs of fluid overload apart from the edema limited in her knee. Glucose: no history of diabetes. Glucose assessed as part of the preoperative protocol, 96 milligrams per deciliter. Holistic emotional support and education was provided. Priya felt anxious about her elective surgery becoming an emergency and depending on others, but she stayed calm and cooperative with her daughter. Recommendations: record any changes that may suggest progression of infection or inflammation. Check if Priya needs to adjust her medication for her chronic condition. Provide walking aids. Thank you.